We're learning more about how climate change impacts our health.
Dr. Abby from Sharp Steely joining us once again. Doctor, good morning.
Good to see you.
Okay, let's talk about this. Climate change. You talk about, is there a link to your health, but obviously everything's connected and kind of the Earth and the planet, but how do you specifically see that connected?
Absolutely. So it really makes sense when you think about how climate change happens.
Yeah.
And I always like to talk about it. I like to nerd out on it because I think it's really fun when you think about the science. But essentially it has to do with the fact that all the things that we do as part of our daily lives increases what we call greenhouse gases, which blanket the Earth and raise the Earth's temperature. That is what ends up leading to all these effects like flooding, increased rainfall, extreme heat. And this has really serious impacts on health. And it's why the World Health Organization has called climate change one of the biggest health threats that we're going to face in our lifetime.
What kind of health threats? Are we talking cancers and things like that? Or?
Yeah, absolutely. When you talk about cancer, actually, that's actually an important one that unfortunately gets missed because we think about, of course, what happens from wildfires, for example, causing more particulate matter, which is air pollution. And that, of course, can go in the lungs and cause lung issues. But it's actually interesting that the NIH released a study where they found that women that were around areas that had more particulate matter had increased risks of breast cancer.
Oh, wow.
So we're actually seeing it with other cancers. And of course, the usual things that you would expect, such as the effects of extreme heat, from flooding, you see things like mold, allergy season, everything that makes you sniffly, sneezy, and to have watery eyes, all of that we're seeing get worse over time. And so it is an urgent health threat, and we really have to pay attention to it.
Let's talk about it. He already asked you about the illnesses, about how it's impacted by climate. Are there more that's on the list besides the cancer and the allergies?
Yeah, so things that you may not even think about. So, for example, in terms of pregnant women, they are affected by this because these extreme conditions can potentially lead, for example, to premature births. Whenever there are increased heat days, we actually see that more people go in the ER and have exacerbation of their chronic conditions. And I think that when you talk about climate change, the way we ask it should change in terms of all the other effects of, increased healthcare costs, increased insurance costs, the mental health stresses from all of these displacements that people have from these extreme weather events. So it's something that we all have to realize affects us.
We just had Earth Day, of course, and a lot of people were talking about how to be more green and help the planet and do that kind of thing. What can we do to protect ourselves along with the planet right now?
So it's actually interesting because a lot of things that you can do are cost saving and also improve your health. So if you, for example, eat more fruits and vegetables, we know that animals produce more methane, which is one of those greenhouse gases. And so if you eat more vegetables, if you eat less processed foods, that actually helps. Then paying attention to what is called your own carbon footprint. You want to focus on recycling. You want to be more sustainable. Walking as opposed to driving, taking the stairs is also something that you can do. So these are things that are actionable you may not think about, but climate change is something that we all have an effect on and that we're all affected by. Every single person has a carbon footprint, so we can all do something.
Sharp Healthcare, I understand, is doing something to help. Tell us a little bit more about that.
Yeah, so it's that important, right? That's the first thing, is that we recognize that it is important not just for our health, but the health of our community. Hospital systems do have a carbon footprint, just like every other system, every other industry. So we have committed to reducing our carbon emissions by 50% by 2030, which is really important. So focusing on sustainability, recycling, educating our patients to say, if we can all work to improving this, it just improves our overall health. So that's really important.
All right, good information. Dr. Abby with Sharp, thank you so much. As always, good to see you.
Thank you.
Good to see you. Thank you.